It just means that they're not forgotten and they're not just numbers. They had lives, they had names.
150,000 hand-painted hearts. The National COVID Memorial Wall now online for those who can't make it to London.
My dad, he always had a smile on his face. He loved life and he lived it to the full.
It was a short ceremony. It wasn't a celebration of his life because there was no one to help me celebrate.
A reminder the COVID-19 bereaved families say of the sheer scale of the loss, and launched on the day virtually all restrictions in England are lifted. So-called Freedom Day, but as the rates soar, those with conditions like blood cancer have no choice but to remain shielding.
I could get very sick if I catch COVID. And although I have been doubly vaccinated, I've had an antibody test done and I didn't raise a very good immune response to the vaccine. So, potentially with infection rates going up as much as they are, I can't go out. I really have no option but to carry on shielding. So it feels like anything but Freedom Day to me.
A number of studies have shown this could be an issue for those with blood cancer, leading now to calls for booster shots to be made available sooner than the autumn. But the Joint Committee on Vaccination and Immunisation, the JCVI, told Channel 4 News that there was not yet enough data and they're looking at it in more detail. It was pretty much the same response too when they said they wouldn't advise that those under 18 be given the jab. The health benefits, they said, remained low. 13-year-old Sophie has barely been to school during this pandemic. She has Down syndrome and other conditions and was told to shield. Earlier this month, we met her and her mother Sue.
All we want is for Sophie to be vaccinated to keep her safe. And I feel that all the clinically vulnerable children have been forgotten about.
Today, though, the JCVI did advise that 12 to 15-year-olds who are vulnerable can now be vaccinated.
Fantastic news for all vulnerable children if the parents wish to take, obviously, the vaccine for the children.
Why is it good news?
It's good news because the children can get back to going back to school, which is very important. Sophie's lost a lot of schooling, as I'm sure lots of other children have. So it will be good for her to get back to school and see her friends and schooling. She's missed so much.
The advice was updated too so that children aged over 12 whose parents or grandparents with compromised immune systems can be vaccinated.
I know that people will have questions about what it means for them and their children, but I can assure them, Mr. Speaker, that nobody needs to come forward at this stage. The NHS will get in touch with them at the right time and they will make sure that the jabs are delivered in a setting that meets their complex needs.
And just 3 months away from turning 18, those teenagers too can be jabbed. A recognition that they will soon be going out to work or into higher education, and for the want of a few weeks would otherwise be unprotected. Well, the JCVI will continue to review new data for vaccinating those who are under 18 who don't have underlying health conditions, but I think there remains a degree of division within the JCVI about whether this is the right thing to do. There are countries, like America, where they have started vaccinating the over 12s, and there was one study of about 1,000 cases which showed if there were side effects, they were short-lived and mild. On the other hand, there have been some reports of myocarditis and pericarditis, which affects the heart, after the Pfizer and the Moderna vaccines. Again, very rare, but there needs to be more data, more studied on this. And this is all against a background in which COVID very rarely affects children, especially those who are healthy. And in a briefing we had today, we were even told those who develop long COVID usually recover in a couple of months. So it's weighing up the risks and the benefits. And right now, the JCVI isn't obviously convinced that this is the right thing to do.
Victoria, we're having this debate about children, but what about other countries that haven't got the jabs even into the arms of the adults?
I know it puts us in an incredibly privileged position. Let me give you some of the statistics from the World Health Organization. So just looking at Africa alone, by the end of last week, there had been a 43% week-on-week rise in COVID-19 deaths. Hospital admissions are increasing rapidly, and there are countries facing shortages in oxygen and intensive care beds. Now, Africa was, at the time we were given that data, less than 1% shy of the weekly peak reached in January, when more than 6,000 deaths were recorded. Now, that is slightly out of date, so they will probably have surpassed that by now. Elsewhere, we've heard of these countries, heard what's happening in these countries: Brazil, Indonesia, seeing an average of more than 1,000 deaths a day, followed by India, which is in the 700s. And still, there aren't enough vaccines being supplied. So if you look at Africa, they need around 750 million more doses to fully vaccinate 30% of their population by the end of this year. And I think it was somewhat of an understatement when the head of the WHO, Dr. Tedros, said last week that the pandemic is nowhere near finished.
Victoria, thank you.